Medications and vaccines have been constantly in the news since the beginning of the year. At different points in time, many hospitals were unable to obtain even essential medications. And a major reason for this is a supply chain issue. So question for Rula, with your expertise in the pharmaceutical supply chain, can you please elaborate on your experiences in the drug shortages space, some of the reasons that drug shortages exist, and discuss how the health industry supply chain crisis has been magnified during the COVID-19 pandemic?
Of course. So definitely, I think it's very important. It's really vital to evaluate the systems that we're a part of, and then the workforce that's really driving and providing the services. So when we understand our systems, we can really co-design better processes that meet our current and future needs. I think this panel really will offer a unique insight into the individual pharmacist contributions, like Mohammed has already alluded to a little bit within these systems. Now, I cannot stress this enough. We are a panel of pharmacists, but you really need to have pharmacists as part of the conversation. Pharmacists must be in any conversations where medications are discussed. Now, if we just take a step back and just talk about the pharmaceutical supply chain, it's truly been become a conversation, I think, among everybody. We've seen it in our homes, we've talked about it with our coworkers, among friends, regardless if you're in healthcare or not. So this is definitely an area that everyone wants to get more well-versed in. Now, the supply chain in general encompasses very diverse stakeholders. So you have manufacturers, distributors, suppliers, health systems, healthcare providers, and ultimately patients. So truly everyone is part of the pharmaceutical supply chain. Now, pharmacists are involved across the pharmaceutical supply chain, and this really speaks to their non-traditional roles. So beyond kind of the traditional storefront pharmacists is to truly see that everyone is working kind of behind the scenes to ensure access to medications. Now, if we look at drug shortages specifically, those have been in the news almost daily for at least 10 years. I've been in this space in the space of drug shortages and pharmaceutical supply chain now for over a decade. And I found that any disruption in the supply chain can lead to a drug shortage. Now, in the US, this is a critical issue as well. We had what we called the peak of the drug shortage crisis, with new drug shortages occurring at an alarming frequency back in 2009 to 2010. There was this huge call to action from various professionals and organizations to truly create the infrastructure to help minimize the number of drug shortages. You cannot eliminate drug shortages because there will always be drug shortages, but to reduce the impact. So back then, around that time, my colleagues and I, we actually documented the impact of drug shortages, especially on the workforce. Because we know any sort of disruption, limited access, a drug shortage, actually, not only does that increase the time of pharmacists, but all healthcare professionals. So nurses, physicians, anyone that's really prescribing, dispensing or administering medications. It's a huge time burden on everyone. And really, since then, I've been involved in the education and training regarding the management of drug shortages. So truly understanding these various dynamics. And when the pandemic first started, there was a lot of talk about shortage of PPE, a lot of talk about shortage of ventilators. But then you had the pharmacy community come out and say, please, we need to shed light on the concerns for medication shortages. Because even if you have a ventilator and you do not have the medications needed to use that ventilator, you're not seeing the whole picture. So back in April, so early on within the pandemic, our organization, Salus Vitae Group, actually put together a series that talks about tackling low medication supplies amidst the COVID-19 pandemic. It's available on our website, so definitely take a look at it if you wanted more resources on that. But over the past several months, we've kind of continued to talk about this issue because it is something that the pharmacy teams and pharmacists can truly play a significant role among all teams. So if you don't have a pharmacist on your team, and regardless of whatever setting, I truly encourage you to reach out to them. Now, there are numerous elements that you need to keep in mind. Just if you look at the sheer number of drug shortages, there are hundreds. So according to the last number, we have 265 active drug shortages in the United States. And that's really important to look at because some of these shortages have been ongoing for years. So this isn't something that we need to think about the next 6 months, 18 months, or 2 years as we start thinking about kind of creating this new normal. This is something that can go on for several years. So kind of building the infrastructure for that. If you look at the supply chain in general, I think that throughout these past 2 days, there's been a consistent theme that none of us operate in silo and that we truly need to help each other with regards to what do we need. And the same applies for the pharmaceutical supply chain, because it is very global, it is very complex. There's all these different individuals that are involved within that. So I think drug shortages in general actually serves as a prime example of one thing that can have a huge ripple effect on many elements of healthcare delivery that really negatively impact access to medicine. So why I say that is that it touches on transparency, it touches on accountability, on drug pricing, on decision-making process, whether you're, again, prescribing, dispensing, or administering this medication. It talks about communication of information and how vital that is. And we've seen that when the wrong information or the specific information comes out about a medication, what that could ultimately do. And it really highlights how quickly a decision made within the pharmaceutical supply chain can reach a patient, right? And whether you get that phone call or whether you're in the pharmacy or whether you're in the clinic or in the hospital and then realize you can't get that medication. So it truly highlights that. But within that, we have to then focus on our communication, our policies, how we collaborate across the industry to really address those types of issues. It also builds on a lot of the themes that we've been talking about the last 2 days in terms of building credibility and public trust with the vaccine and with the treatments, and how it's our individual responsibility to ensure that with our patients. So I think it definitely touches on multiple parts. And then if you look at just drug shortages in general, the reasons before the pandemic, if we now move towards the pandemic, for drug shortages, a majority of the reasons were actually manufacturing or quality issues related to those medications. Now, when COVID came, the concerns for drug shortages during COVID was due to the spike in demand. We actually you saw that with the concerns for antidepressants and other medications, where any medication, not just COVID related, when there's that spike in demand, you could see a drug shortage. Now, in the particular case of COVID, the shortages and potential shortages that resulted early on and that we were concerned about were medications used during intensive and emergency care. So those medications were particularly vulnerable. And then the teams, specifically the pharmacy teams, recognized that very early on and set up those infrastructures to try to reduce the burden of that. So on a basic level, you need those medications like sedatives and paralytics for the ventilators. So I think that just kind of speaks to how pharmacy teams operate and how pharmacy teams over the course of a decade have really built their own teams out to create and evaluate their processes, create contingency plans, and really kind of take a holistic approach with their healthcare teams.
Next question to Rula. You were recently featured on a Microsoft webinar and discussed the role of technology in healthcare. Can you elaborate a little bit more on this growing space, tech in healthcare, especially as it relates to innovations in pharmacy practice models?
So I think we can all say with certainty that technology is an integral part of our lives during COVID across all sectors, including healthcare. Now, in times of urgency, technology can be leveraged in new and enhanced ways, and we've seen that, but specifically to improve access and efficiency. And we can also utilize it to partner with diverse stakeholders to provide that type of information that we have to quickly communicate that with all those that are within the care of our patients. And definitely the ability for it to generate greater information and make that information more useful. We're seeing significant investment in technology and automation in general within healthcare, specifically within the pharmaceutical supply chain. The pharmaceutical supply chain over the years, again, there has been technology invested in it, but now we're trying to see more of that because technology has played a greater role. Now, stakeholders are truly open to discussing how we can leverage digital tools. So that's something I think many speakers have talked about throughout in terms of the growth of digital health, telehealth in their practice, and pharmacy is no exception. Also, technology can play a big role in quality assurance. Like I mentioned before, some of the issues regarding drug shortages was manufacturing and quality issues. And so technology can truly play a role there. There's a potential for it to validate the authenticity of medications because safety and quality is of great importance. Also during COVID and any times where there's the surge of demand, we are often concerned about unregulated supply chains. So trying to really know and understand where the medication comes from, how it moves through the system is so critical. So you can integrate technology throughout the quality improvement process as well to ensure safety and quality. So manufacturers can actually stay up to date on the latest manufacturing requirements, which will truly help them with that as well, because those are constantly evolving. We've also seen technology play a role in inspection requirements and next steps. But of course, technology must be inclusive and trusted, and we need to be able to understand the limits of automation. It is not the one solution that will fix everything. From a pharmacy standpoint as well, we've seen increase in the delivery of medications using drones, and we've seen increased automation in general because the workforce shift. So it's not only that there's changes in the workforce because some institutions actually had to close down due to social distancing, physical distancing. So the workforce number decreased. And so there is need to kind of push for greater automation. Also, technology plays a huge role in the transparency and increased visibility. And that is so important because the more we understand where our medications come from, in terms of what step what step they take within the pharmaceutical supply chain, the more critical it is. Because right now it's so global that yes, we have medications here, but we don't know where they've gone and where they've been. Transparency of information and data is also a huge area for technology. The tracking and traceability, like I mentioned, in terms of following the medication and tracking that data. We're also using technology to manage inventory in general, to truly try to see, because you would be surprised, even at large medical centers, sometimes they don't really know how many of that what's the quantity of the medication they have and where exactly it is, even within their own health system. And so when you get the call that you are not able to get that drug anymore, you have to quickly react. And so technology can truly play a role there. Also, there's a lot of conversations on stockpiles. So you have a national stockpile that does not just include COVID-related medications, right? It should include essential medications for the populations that they serve. But institutions themselves also have what they call their mini stockpiles of their own institutional needs. And those usually run from like 3 to 6 months, depending on how capable the institution is to have a stockpile for long periods of time. But stockpiles are carefully designed in that you have to look at your inventory. You have to understand what your needs are. There's another concept called hoarding, where you're basically hearing that a specific medication is going to be in demand and we might need it, and you just buy out a lot of it and just put it in a room and pile. That's called hoarding. That's not the basics of why a stockpile existed. A stockpile is to meet your own needs. So technology can truly play a huge role there. Now, the true value of the best technology for prediction and forecasting is actually revealed when relevant partners are able to utilize and benefit from the technology. So that means we need information that can drive action and behavior to the appropriate stakeholders. We have so much data now, but it's how we leverage that data. And I think predictive science is going to be very interesting and very critical to not only understand what we need in terms of medications, but also the talk over the past the past 2 days about also thinking about a possible next crisis and planning for that. So technology can and has been leveraged across the supply chain. Our future is going to continue to be very data-driven. Technology will augment our advances in our professional skills. So we've talked a lot about what is needed of us individually as a workforce as we build our capabilities, and technology will be there to assist. So the trade, how we trade in the global pharmaceutical supply chain will change. And so documenting that and understanding manufacturing process is going to be also very critical. And I think it'll allow us an opportunity to understand what we're doing individually and then talking about what we're doing as a whole in order to ensure equitable access. So I take actually a global perspective of our profession from individual institution, of course, then globally. And I truly believe, and I think building on the conversation that we have, interdisciplinary gets at looking at who is necessarily an expert or really good and offers a unique perspective, and having them come join the table. And I think adapting to our new normal we should, I think, shift that to say how we can co-create it together and understanding where our true value is, and building on what Mohammed and Yemen have been saying in terms of, and even Maned, in terms of where we position ourselves to be part of these teams to offer the best care for our communities and our patients and to improve access. Now, we at Salus Vitae Group actually decided very early on that although the leadership team is composed of healthcare professionals, that our conversations and our initiatives need to include diverse stakeholders. So that's a collection of experts, leaders, citizens, and communities, all willing to tackle the issues and create sustainable solutions. Because we as a society have actually come to realize that the transfer of knowledge and information across disciplines is far more powerful than any one discipline can achieve alone. And I think I strongly believe, like many others here, that our solutions are not also just going to come from healthcare alone. We have to have experts and innovators in the world of technology, business, engineering, communication, and many more to work side by side, because access to medicine isn't just a one discipline problem. And we're required now more than ever to create new ways, creative ways to work together, because the current COVID-19 crisis has only amplified our need to create this collective plan forward. And I think it's fascinating to continue to see how we can find better ways to work together to ensure that. And I just wanted to add this, I think conversation has been really great, but I think keeping in mind as we move forward, the themes that have kind of been consistent across the conference in terms of, breaking the silos that we have within our own individual profession within healthcare to truly help each other and not to just adapt, but to co-create. And then for this equitable access kind of across, whether it be to medications, to services, as we all try to, manage everything that's going on right now. So we are truly highly dependent on each other, and we just need to create the systems to ensure all of our successes.